Hello.
Hi, Katie. How are you today?
Hi, Eric. It's an absolute pleasure to be here with you. Really delighted that you agreed to be interviewed for Emerging Proud. And you are the author of over 50 books, have a doctorate in counselling psychology, and are the leader of the movement, the future of mental health, deconstructing the mental disorder paradigm, which was why I was so excited that you agreed to be interviewed, because it feels so aligned with the Emerging Proud campaign and what I'm trying to achieve by kind of raising awareness and really trying to normalize what it means to be a complex human being. So just would love to speak to you more about your movement today and share with everybody your work and what you're hoping to kind of bring, and what changes you're hoping to bring to the mental health world as well. Would you mind giving people a little bit of background about yourself and what kind of led to your interest in this field?
Sure. I've had many interests. I started out as a young person in science, I thought I'd be an astronomer way back when I was 13, 14, 15. Then after I entered the Army and left the Army, I had no idea what I wanted to do, and so I got a degree in philosophy. That was my first degree.
Wow.
I've been interested in ideas all along, but of course, one gets a little tired of just doing abstract ideas. So then I turned to novel writing and other kinds of writing, and I started writing my first novels when I was in my early 20s. And then at some point, I segued into psychotherapy and became a therapist for creative and performing artists. It was in the training for being a psychotherapist that I began to doubt the paradigm. I kind of wasn't believing much of anything I was hearing about how I was supposed to think about folks I was seeing. So I segued out of psychotherapy at some point, as I say, because I didn't really believe in the paradigm. I didn't believe I was diagnosing and treating mental disorders. I thought I was just helping folks with problems in living. And so I moved into what I began calling creativity coaching. That is, coaching creative and performing artists. And I've been doing that for the last 25 years or so. But simultaneous with working with creative and performing artists, I've been working still with the idea of deconstructing the mental disorder paradigm, which I think is a disastrous paradigm. Really just essentially fraudulent. I think most folks, even if they have an inkling that the idea of mental disorders is an odd idea, they still probably have never bothered to look at the definition of a mental disorder as promulgated by the American Psychiatric Association. If you bother to go read it, and by the way, it changes from time to time for no particular reason except to include more people as mentally disordered. About the only reason the definition changes. But if you go and actually look at the definition, which is in the DSM, the Diagnostic and Statistical Manual of the American Psychiatric Association, you'll find it to be a completely empty definition full of clauses and commas and words meant to say nothing. It's one of the things that interested me in philosophy way back when was what's called linguistic philosophy. It was a turn of the last century movement, primarily by British psychiatrists, psychologists, and philosophers, to look at how language was really used. I think Orwell, most folks watching us will remember George Orwell writing about language and in 1984 in Animal Farm, and how peace is war and war is peace, and how the powers that be use language to manipulate. Well, the mental disorder world is one of those places where language is used to create out of whole cloth the idea that folks are mentally disordered by collecting these things called symptom pictures into labels. So to make this long story short, there was a movement that started in the 1950s by the American Psychiatric Association to create mental disorders for profit. And it grew slowly, but then grew much more rapidly in the last dozen years. And where it's especially egregious is with respect to mental disorders of childhood, the idea that virtually everything that a child does nowadays, especially everything that a boy does nowadays, is a symptom of a mental disorder. Any squirming, any opposition, any sadness, anything that a child displays is a symptom of a mental disorder. And what's gotten even worse than that is the new movement to be able to predict mental disorders in childhood, so that even if a child is displaying nothing yet, well, if his parents are clinically depressed, well, maybe he will get depressed one day. So let's start medicating him now at 6 months or a year and a half or 2 years. So for me, adults accepting the labels they get, that's one thing. They're adults. They shouldn't do it, but that's one thing. But children have absolutely no power in this. They're victims of this system. And somebody has to speak up on their behalf and help them.
It's frightening, isn't it? It's really frightening how that paradigm has kind of grown and the momentum behind it. It's amazing the awareness that you're raising through your interview series, and I know your latest interview series is specifically about children. Is that right?
It was. I've just done an interview series with about 24 folks from around the world, mostly professionals, but also parents, just to help get out the word that if you are a parent being pressured into accepting a diagnosis for your child, that you may not want to go down that road. You may not want to accept the label and what follows from the label, which are chemicals. It's very difficult to help parents understand this because they're bombarded on all sides by language, by a vision, by a paradigm. And they can't really help but think that these things called mental disorders actually exist the way that physical disorders exist. This is really the power of metaphor and the power of analogy. You know, because mental disorders sounds like such a powerful analogy to physical disorders, it's hard for a person to understand that they're not the same things, that there is no such thing as a mental disorder. There are all kinds of phenomena. There's sadness, there's hearing voices, there's anxiety, there are all sorts of things. But to combine symptoms into symptom pictures and then call them some particular disorder makes no particular sense. If the Diagnostic and Statistical Manual were an actual manual, the way an auto manual is an actual manual that helps you fix your car, were it an actual manual, it would do two things. It would tell you where things are coming from, it would tell you what's causing a problem, and it would tell you how to treat the problem. And the DSM is silent on both causes and treatment. And when you wrap your head around that idea that it's silent on causes and silent on treatment, then you can begin to really wonder about what is it. It's as if when a red light came on in your car on the dashboard, you would be able to say, my car has red light-itis.
Yeah, exactly. And also,
what would that mean? It would mean nothing to you.
Yeah, precisely.
And if I were to say to you, well, whenever you see the red light-itis sign, you know, stop your car for 20 minutes, there'd be nothing plausible about the connection, one thing and another, if you're not telling me what's causing something. So at any rate, that's what interests me the most, is deconstructing the paradigm. A lot of people are particularly interested in minimizing the use of these things called medications. That's important to me too. But for me, there's the step before the minimizing the use of medications is to understand that they are not medications, but chemicals with powerful effects. That's important for folks to understand because there's a profound difference between a medication that's actually working on an illness and a chemical with a profound effect. I think the following analogy gets at it pretty simply. If there were a raging rhino coming at you, we could put that rhino down with a tranquilizer dart. We have chemicals with effects. We could knock it out. But that wouldn't mean that we had any idea why the rhino was raging or that we were actually treating it for anything. We were just using a chemical with a powerful effect. That's pretty much what we're doing with psychiatric medications. We know that chemicals have effects. We can make you duller or number or less anxious. We can do things to your body with chemicals, but that doesn't mean that we're actually treating something. It doesn't mean that we have any idea what's going on in your life or in your body. So that's just a huge difference.
Yeah, firefighting, isn't it? Without knowing what you're fighting the fire with as well, I suppose. I think
that's right, and it's an interesting analogy, the firefighting analogy, because maybe most of the time it makes sense to throw water on a fire, but it doesn't make sense to throw water on certain kinds of fires. That makes that fire larger.
Yes.
That's when you have to use foam or something else.
Yes.
So if you don't know what's causing the fire and you just keep throwing water, and then if the fire, what's interesting about psychiatric meds is if the fire then gets larger, you never think that perhaps your treatment, that throwing water on it, is the problem.
Yeah.
You just say that, well, we'll throw something else on it additionally because the water is not enough.
Yeah.
That's how people get on 2 or 3 or 4 psychiatric meds. Rather than looking at the ineffectiveness of the first one, there's just this add-on component of, well, if that's not doing the job, let's add on a second and a third and a fourth chemical.
Yeah, that's a brilliant analogy, actually. I hadn't thought about it like that before. Yeah, that perfectly describes what happens, I think, in psychiatry. It's about the not self-reflection thing, isn't it, as well, and not looking at the root cause. I think, there are so many people now speaking out about this around the world, and your interview series with 100 people as part of your Future of Mental Health movement kind of spoke to that. I just wondered if you would describe what that was about and who was involved and kind of where that went, what you wanted to achieve by that interview series.
Well, what I wanted to achieve is the simple thing of just putting out the word about these issues, because there's no simple sentence to say. It's very hard for us to get traction. Nietzsche had it easy when he said God is dead. That was a lovely, simple sentence that helped in some corners end religion and belief in God, because it was a crisp 3 words. We don't have a crisp 3 words for what's wrong with the mental health system. We have to say long sentences with commas and clauses. So it's a little trickier. So for me, it's sort of like a mosaic attempt to do a little tile here and a little tile there and hope that ultimately there's a big picture change. But as to the series, many of the interviews were with folks who are connected with the British Psychological Society. In the United States, we have much more allegiance to the Diagnostic and Statistical Manual model. Throughout the world, there's a separate book called the ICD, which does the same sort of work, and Europe and the rest of the world functions with that guide. The British Psychological Society has been issuing what they call reports. They're actually book-length books tackling different so-called mental disorders like bipolar or schizophrenia or what have you, and looking at it from a non-medical perspective and asking folks to think about these disorders as not mental disorders, but as so to speak, natural results, natural coping mechanisms with life's challenges.
Yeah, yeah.
And so having many of the members of the British Psychological Society aboard was great. There were also members of the Humanistic Division of the American Psychological Association. The Humanistic Division is the division most interested in looking at these problems as life experiences, life challenges, rather than as medical issues. So had folks from all over the world. It was a very well-received interview series. The problem is that when the mass media decides to do a series on mental disorders, whether it's the BBC in the UK or whether it's PBS in the United States, they turn to the usual suspects. They turn to psychiatrists and other mental health professionals who are aligned with the current paradigm.
Mm.
And so even though they are our most progressive media, the end result is still the same reactionary support of the paradigm. This happened recently with a big BBC series and a big PBS series. And those were opportunities for the critical psychology or critical psychiatry view to come out, and they didn't really. They were more just about why is there more depression or why is there more anxiety or what's causing these disorders, as opposed to are they disorders and should we look at this differently?
Yeah, exactly. It's all in the linguistics, isn't it? Which adds to somebody's kind of decreasing sense of self as well. If they're suffering from something a normal reaction to something, and it gets labelled as a disorder.
Absolutely. I mean, it's interesting to me, and it takes a lot of, I think, grandiosity for a master's level practitioner with no medical training. Like, my background as a psychotherapist is as a marriage and family therapist. That's my license. That's my California license. I have a PhD, but you only need a master's to get this license. And yet I'm entitled to call the people I see patients. It's a very interesting idea. How does a master's level person with no medical training get to have patients? I think if you are calling the people you are seeing patients, that's pretty grandiose on your part and pretty inappropriate. Even calling them clients is a little inappropriate because there's a class structure basis to the word client. But yeah. I'm okay with client. I've worked through all of these different words, and if you want to call the person you're working with a client, that's okay. But it's actually not okay to call a person you're working with a patient if what is troubling them is they hate their job or they're in a bad marriage. Or to call that person a patient is already weakening them, and it's setting them up for the idea that there's a chemical to help them.
Yeah.
The second I call you a patient, I'm priming you to believe that there's some pseudo-medical treatment that I'm going to offer you, which is a little nutty that I, as a master's level non-medical person, should be trying to set that up with you, that there's going to be a medical intervention here of some sort.
Yeah, I really love that you've mentioned this, Eric, because, I mean, something that we talk about a lot within the spiritual crisis, spiritual emergence movement is the fact that everybody's a teacher and everybody's learning. We never achieve until we never actually get there. We're always learning. And it's about there being no hierarchy and coming together as human beings. And that's the new open dialogue movement is trying to kind of shift that kind of power imbalance as well.
And not only, that's right. I mean, not only is there no hierarchy, there's so much not knowing.
Yeah, yeah.
There's just so much that we not only don't know, but can't know. And human beings don't like to believe that they can't know things. But I have a little model of personality that's made up of 3 parts. I believe that we have an original personality. That's the endowment we come into the world with already. If you've had kittens or puppies or kids, you know that each one is already its own entity when it comes into the
Oh
world.
yeah. Oh yeah. Yeah.
Then over a time, I think we accrete what I called our formed personality,
Mm.
sort of who
Mm.
we are repetitiously. And then the third part for me is what I call available personality, sort of our remaining freedom
Mm.
to be the person we want to be. But
Mm.
it's that original personality that's really very interesting, because let's say you come into the world a little sadder than the next person already.
Mhm.
That's not a mental disorder, that's a difference.
Mm.
And I can't ever know that about you, and I'm not sure you can ever know that about you, because
Mm.
what would you have to compare that to?
Yeah. Yeah.
So if you're a smart, sensitive, sadder than usual person to begin with, you're going to have life challenges, but neither of us, neither you nor anybody you're speaking to, can know whether that's something you've acquired over time
Mm.
or whether that's a function or a feature of your original personality.
Mm.
To somehow demonize that or pathologize that is just a complete mistake. It's just who you are.
Mm.
It's as if I was trying to say something about your intelligence or some other feature of original personality
Mm.
and acting as if it were a disorder of some sort, or a specialty of some sort. Either
Mm.
way,
Yeah.
it's just who you are, who you come into the world.
Sure.
We all agree that that may produce challenges that you have to live with forever. If you're more sensitive than the next person, if you're sadder than the next person, if you are more vigilant than the next person, if you're different, if you're off average in any way, that's going to produce its own challenges. And then
Mhm.
you'll have to figure out ways of living with those challenges.
Mhm.
And as a helper, I can help you without ever knowing what your original personality is, because we have ideas about what helps.
Mhm.
Even if it's something as mundane as sunlight or exercise, or just things that help human beings feel better,
Mhm.
we can offer things that help.
Mhm.
But that doesn't mean that we ever actually know what's going on.
Yeah. Yeah. Which and does the opposite to negating that personality and lowering the self-esteem and creating more guilt and shame through pathologizing those things.
That's right.
I
It's
wanted.
interesting. Go ahead.
Sorry, no, no.
No.
I was just going to bring it kind of round to your next book that's due out next year, because I think we're talking about this now. Really, it's called Humanizing the Helping Professions. So I just wanted to kind of obviously relate to that here, because this is what you're alluding to. I
Yes.
presume, Eric. It's
Let me just clarify. My next book is a book called Overcoming Your Difficult Family.
oh, sorry.
That
you,
comes out next year.
gosh, there's so
Um,
many.
I've been announcing a book that comes out in 2018. That's the one you just mentioned, because I've been asking for input into that book. So the book you just mentioned actually comes out in 2018
Okay.
from Routledge, Humanizing Helping Professions. There are an awful lot of helpers, including psychiatrists. People who are watching probably don't have a refined understanding of the distinction among mental health helpers. It's important that one does, because only psychiatrists are medical doctors who prescribe, but there are a whole array, many more mental health helpers by numbers who aren't psychiatrists, whether they're psychologists or mental health counselors or family therapists or clinical social workers. To make that long story short, there are a lot of helpers out there with different labels,
Mm-hmm.
including coaches and including other kinds of helpers who have to deal with people in distress, like nurses. And we could name a lot of people whose primary job is to help another human being in distress. Right now, there are essentially two paradigms. One is the pseudo-medical model paradigm of mental disorders and chemicals. That's the major paradigm. The second paradigm is still the talking cure paradigm, the psychotherapy paradigm, the idea that whatever it is you have, I can help you just by talking about it, which is interesting. It has its own flaws as an idea, but still, I think basically we all agree, those of us who believe in this humanizing model believe that talking does help. Talking is a good thing.
Mm.
but not the be-all and end-all.
Mm-hmm.
More is needed. Actually, outcome studies show two things pretty regularly. Outcome studies as to the effectiveness of therapy. One is the warmth and supportiveness of the therapist really matters. That I'm a human being matters.
Yep.
If I'm sitting with you, that matters more than my theoretical orientation
Yes.
or expertise or whatever.
Yep.
It's that I can actually listen to you and care about you. But the second thing that matters is that you're actually interested in the work. Is that you're actually available to do some work with me. That you're not too difficult or defended or just not present in the work. So the Humanizing the Helping Profession book is about how to help me better understand how I can help you, including help you understand, and this is a big chunk that's left out of almost all psychotherapy, to help you better understand your life purposes and how you can keep meaning afloat in your life. That's not something that most psychotherapists talk about because they think by mandate that they're supposed to be thinking about or talking about psychological issues primarily, as opposed to existential issues or life issues or spiritual issues or other kinds of issues, which are fundamentally important to people, but not actually in the mandate of a psychotherapist. So for me, part of the humanizing is expanding what the helper, not going to call the person a psychotherapist or anything like that. We need actually a new name for the helper, whom I sometimes call a human experience specialist. But whatever the name ultimately becomes, the person who has a larger grasp of you in context than just narrowly looking at you as a biological creature and looking for a mental disorder, or as a psychological creature with mother issues or some kind of issues, but rather stepping back and seeing your whole context, which might be poverty, class issues, racial issues, a zillion things that may be up for you, including the ways you've figured out how to cope over time, which may be not very effective, but the ways you've learned to cope and your sort of default go-to ways to cope that maybe aren't serving you, but that you're completely familiar with, and that's where you go in life. So that's what that book is about, is attempting to help helpers just become more humane and include a bigger picture when they're sitting with a person.
Yeah, that's really interesting. It's so vital, isn't it, to shift the perspective from looking at what's wrong with somebody to looking at the potential. And that's something I was going to ask you about, actually, about your work around this coaching, because you're one of the world's leading coaches around purpose. And I think that's would you agree, one of the biggest causes of kind of depression and existential crisis is when somebody doesn't have meaning and purpose in their life?
Absolutely. For me, the thing called clinical depression, which we used to more honorably call sadness or despair or anguish, one of those kinds of words, for me, a lot of it, I wouldn't know how to give a percentage or... But for me, a lot of it is the individual having decided just out of conscious awareness that life is a cheat. Life is unfair, that life is unjust, that they're not getting out of life what they had hoped to get. And this could be at any level, whether it's they're not getting, the relationships are not working, or they had a dream, or they never had a dream. They wanted a dream, never had a dream, or they had a dream and they're not successful at their dream. For me, I work with creative and performing artists, 99% of whom can't make it financially. That's the sad reality of the art world, is that there's really no middle-class artist. There are celebrity artists and then poor artists. If you're a middle-class artist, it's because you're teaching or doing something else as a day job. That's all by way of saying that there are an awful lot of people out there, I would say in the billions, whose background coloration is a kind of day in and day out sadness because they're finding life to not measure up to what they had hoped it to be. And they don't throw in the towel, they don't commit suicide, they don't throw in the towel because they have responsibilities, and enough things in life are worth living for, even if it's just the TV series you're watching and enjoying, or chocolate, or there may be only small things that you're living for, especially for a lot of seniors. I think there are only small things that they're living for, but there are still things you're living for, but you're just kind of hanging on existentially. That's why I think it's so important to help people make what for me is a paradigm shift from seeking meaning, the idea that meaning is out there, which is the paradigm that's been out there for thousands of years, that there's meaning out there somewhere and you have to go chase it, or it's like a lost person, you have to find it somehow. You have to join a religion or go to the top of some mountain, or to the more contemporary and I think truer idea that we make our own meaning.
Find it within.
Meaning. We create meaning. That meaning is merely a certain kind of psychological experience that we can kind of entice into being by virtue of doing those things that are important to us, living our life purposes. There is no purpose to life, I don't believe. There are only our life purpose choices. Things we deem important and then do. Or be. They can be doing things like being of service or creating, but they can also be being states like being calm or being passionate.
Yeah.
So there are different ways to conceptualize life purpose, but the basic idea is that that's on you. You have no life purpose, really, until you identify and articulate your life purpose choices. Until then, you're still in that seeking place of why is it that I don't have life purpose? What is the purpose of life? What's the meaning of life? Those are the wrong questions. The right question is, let me choose my life purposes and live them, which is actually very difficult to do.
Yes.
It's difficult to identify them, and then it's difficult to live them. The identifying them is not so difficult. It takes a little work. But then the living of them, the actual getting of your life purposes onto your daily to-do list is an interesting negotiation, because most people have filled up their day with non-life purpose stuff.
Sure, huge challenge, isn't it? And that's one of your workshops that you lead. Is it?
It is
finding your
And what I help people understand is that life doesn't have to be full of purpose or empty of purpose. Maybe you have 2 or 3 hours of meaning a day. That may be sufficient, as long as you're understanding how life works. If you were to invest meaning in 1 hour of creating and 1 hour of relating and 1 hour of being of service during a day that's otherwise filled up with activities that don't matter that much to you, at least at the end of that day, you could say to yourself, okay, I did my hour of creating, I did my hour of service, I did my hour of this. I had a day that matches my vision of what my life purposes are. And it was a day that made me proud.
Yeah, lovely.
So I think that effort to make ourselves proud is much more important than any kind of effort to make ourselves happy. So chasing happiness, I don't think that's what we're after. I think we want to live in a way that matches our vision of our values.
I think, happiness is futile to chase. It's a byproduct, isn't it, of doing what you love to do.
It is, and let's say you're a novelist, and the dirty little secret is that probably 2/3 of the days of working on your novel, you hate your novel. It's recalcitrant. It doesn't want to go where you want it to go, etc., etc. So you're not happy on those days struggling with your novel, but there may be a moment at the end of the day of a kind of satisfaction of, okay, I worked hard today. To live for those moments is odd. I think we don't quite understand that it's that moment of happiness that we're after. Not happiness, but just the moments of happiness that reflect the fact that we're living our life according to our values and our purposes. So we may have had a sloggy 8 hours of work on a book, completely sloggy 8 hours, but then we get our 1 second or 3 seconds of satisfaction. And that's how it works.
And
that's how life works when it's working well.
I suppose it's a recognition that we're on our path.
That's right.
Yeah.
That we're on our path, and also that I think it's a pride thing. It's like, okay, I did my thing today. I successfully did my thing today.
So what would your vision be, Eric, for the new paradigm, for your what is your kind of purpose leading you? Where are you hoping to go with this shift, this future of mental health? What does the vision of that look like to you?
I think it's a baby step vision. I think it's more and more practitioners changing their actual practice, and also speaking up a bit. So it's the dual road of individual practices changing and more folks disputing when a new diagnosis comes down the pike, saying it doesn't make, this new mental disorder doesn't make any sense. I don't think the whole system can be overthrown anytime soon, just because of the power of pharmaceutical companies. Those are the pushing agents for all of this.
Yeah.
They're too powerful. And mental health professionals also, just for basic ego reasons, financial reasons aside, basic ego reasons, don't want to admit how little they know. So
it's difficult.
Would be lovely. It doesn't encourage prospective clients or patients to hear how little we all know. It's not very encouraging. It's only truthful. But if there could be that kind of shift where language was used well, so that we could say we don't know a lot, but we can also help you while we don't know.
Yeah,
If that could get said well, then maybe the whole thing could shift in the direction of a movement away from pseudo-medical mental disorders towards just humane helping.
Yeah, I like that. I like that vision, actually, of fairy steps. I think it feels much more achievable and graceful, actually, than trying to kind of really just knock down the system. Because I don't know how you feel, Eric, but to me, because I used to work in the system, and I went to work in the system wanting to help. People don't go into the system not wanting to help. It's just that things have become, that they're based on no evidence, and I think it's just from a naivety. It's not from a conscious decision not to want to help people. So I suppose through your work, through raising awareness, through the collaboration and bringing everybody's voices together, that's hopefully what will happen, is a shift will gradually unfold. And I'm so grateful.
I mean, it's in a way too small a vision, because there are too many millions of kids getting embroiled in the system every year. With really unfortunate results. So it's hard to set that modest division as the vision, but unfortunately, I think that's what's true, is that it has to work that way. I wish there could be bigger, quicker changes.
Oh, yeah, absolutely. I couldn't agree with you more. I mean, I wouldn't be spending all of my time doing this if I didn't share that vision. But
the avant-garde painters of the beginning of the last century, the beginning of the 20th century, had a phrase where they wanted an audience of one, because they weren't sure that more than one person would understand what they were doing. The Cubists and Picasso and all of those folks. Now, of course, for ego needs, they wanted more than an audience of one. They were egoists, and but for me, there's something about that feels right, to just imagine helping one parent or one person. It's a super modest goal, but it's also a heartwarming goal.
It is, because if you imagine if everybody in the world could help one person,
Yeah,
then the world would be healed. So,
that's right.
yeah, that's beautiful. Thank you so much for everything you're doing. It feels huge. I mean, 50 books, interviews
Yes.
with thousands of people around the world. It's not a modest vision at all. I think the work you're doing is incredible. So thank you so much for that and for sharing with us. Really appreciate your time.
Thank you so much for having me. It's been a lot of fun.
Thank you, Eric. Really appreciate it. And I shall send you my admission for your next book.
Okay.
Thank you. See you soon.
Bye bye now.
Bye.